There have been reports over the weekend that the government has drawn up a three-stage plan for ending the lockdown, which includes potentially opening schools from the 11th of May, some non-essential retail businesses, and then allowing small gatherings by the end of the month. Now, of course, I know there are huge caveats here. Nothing has been decided. But is that correct?
No, it's not. It is the case that we are looking at all of the evidence, but we've set some tests which need to be passed before we can think of easing restrictions in this lockdown. It's very important when we're still in the process of making sure that we can reduce the rate of infection and also reduce the number of deaths, that we maintain the steps that we have. Now, of course, we're looking at the data. It is the case that the rate of infection appears to be flattening, but we do not want to take steps too early because the most important thing is to make sure that the NHS and the public's health is protected.
You can tell that people agree with that assessment. That's why so many people are obeying the lockdown, staying at home to try and protect the NHS. But if we're looking at a kind of roadmap, if you like, out of the lockdown, which many people would like to see, it's been a difficult period for many people already. Is it right, the broad brush direction, for example, that schools and nurseries may be one of the earliest things to open?
No, I think it would be wrong to get ahead of ourselves here. It is the case that if we manage to ensure that the rate of infection is kept low, if we can see the rate of deaths falling, if we can make sure that the NHS's capacity is as strong as it can be, then we can think about some of the steps we may be able to take in order to release some of the restrictions that are already in place. But the important thing is that we're guided, as we have been throughout, by the facts and by the scientific advice that we receive. And the facts and the advice are clear at the moment that we should not be thinking of lifting these restrictions yet.
Clearly coming through that the timing of this is something that is still being looked at, that nothing is going to change yet. But is it not fair to say what could change, even if you can't say when it would change? People are smart enough to realise that they have to stay home now, but they may look to asking the government about what the plan is in a few weeks' time or a few months' time.
It's entirely understandable, of course, that there should be a public debate about how we approach these difficult choices. But the most important thing to do is to make sure that we proceed in a way that's guided by science. And one of the things that we need to have are all the facts, all the data in front of us to know what would be appropriate to do and at what time. So the steps that we've introduced have been determined by the advice that we've received from the government's scientific advisory group for emergencies, and they and others are looking at the facts that we have now, and it's on the basis of those facts that we will then say what we believe is the right process and the right timescale for easing these restrictions. And I appreciate, obviously, that if we're thinking in due course of particular settings coming back and operating, we need to make sure that those settings have time to prepare. Absolutely. But it is also the case that we need to make sure that when those settings do come back, whatever the appropriate area of our life, our public life it is that has the restrictions eased, it's also important that we bear in mind what the new situation might be in those settings, because one of the things that we've learned from this new and deadly virus is that after we ease restrictions in some areas, there will still be a need for discipline in others, and we need to make sure that the approach that we take is informed by the science and that the measures on social distancing and on protecting individuals, particularly public sector workers, are appropriate.
Talking about being guided by the evidence and the science, the number of people dying is still breathtakingly high, of course, but are you hopeful that we may be past the peak?
Well, you're absolutely right. And one of the things that is deeply worrying and concerning is still the high level of deaths. And as you've reported and recorded, and as we know, every single death is the loss of a loved one and will cause grief and heartache for families across the country. And it's precisely for that reason that we don't want to lift restrictions before we can be confident that we're in a position where it's safe to do so. Now, the evidence suggests that the rate of infection and the death rate is flattening, but we're not absolutely certain that we are yet on a downward trajectory. And we want to be heading towards that downward trajectory to be confident about all the steps that we might want to take.
I want to ask you about the Prime Minister, who of course is still recovering at Chequers. How is he, and is he going to be doing any work in the coming weeks?
Well, the Prime Minister's recovering well. He's in cheerful spirits, and he had the opportunity to talk to Dominic Raab, his deputy, the First Secretary of State, on Friday, and the Prime Minister's instructions to the rest of us in government were communicated by the First Secretary of State when we had a conference call yesterday morning. So it's good that the Prime Minister is recovering. He's following, of course, the advice of his doctors in order to make sure that he rests, recovers fully, but he's absolutely on top of things, and it's I think the wish of all of us that the Prime Minister is restored to full health as quickly as possible.
Now, I'm keen to move on to some of the criticisms of the government response to COVID-19 now as well. New supplies of personal protective equipment have arrived in the UK today after healthcare workers were told that they may have to reuse gowns because of a global shortage. Can you guarantee that those people now on the front line, risking their lives for all of us, will now have the protective equipment that they need going forward?
Yes, it's the first priority of government and of my colleague Matt Hancock and I to ensure that we protect those on the front line who are doing so much to keep the rest of us safe. It is the case that there's a consignment of personal protection equipment that's arriving from Turkey, which contains tens of thousands of gowns. It's also the case that we have a deal with China in order to bring in due course some 25 million gowns over to the United Kingdom in order to make sure that people are kept safe. Gowns are the area at the moment where there is the greatest need, but we also need to make sure that people have the appropriate face masks, which allow them to operate in these clinical settings, and also that people have the visors and the gloves and the other protective equipment that they need. And today, Lord Dayton, who was responsible for the organisational success of the Olympics in 2012, has agreed to lead the task force, which is making sure that we have all the personal protective equipment that people need in the National Health Service, in care settings, and also more broadly in the public sector.
It's interesting to hear that protective equipment is coming to the UK from China, because according to a report in the Sunday Times, the opposite thing happened a couple of months ago. It's a pretty damning investigation by the paper saying that the government lost 5 weeks in the fight against coronavirus by missing those early warning signs. And despite low levels of protective equipment in the UK, by late February, the UK had sent 266,000 pieces of protective equipment to China. Is that correct?
Well, there are one or two aspects of the Sunday Times report that are slightly off-beam, but the most important thing to stress is that the fight against the coronavirus is an international effort. So, of course, we've been cooperating with the Chinese government and with other governments, but one of the things that we have done is to make sure in advance of this
So what is incorrect in the Sunday Times? Apologies for interrupting, but what is incorrect?
I won't go through here a point-by-point rebuttal of all of the things in the Sunday Times story that are, a little bit off-beam, but that will be done later. But the most important thing to bear in mind is that the personal protection equipment stocks in this country were built up in anticipation of a flu pandemic. They were supplemented as a result of our planning for a no-deal Brexit. And it's also the case that we've been collaborating with other countries, including China, not just on making sure that we can have the personal protective equipment that people need, but also that we have the ventilator capacity that people need. And we're also collaborating, as the Business Secretary pointed out on Friday, in a worldwide effort to try to secure a vaccine for this virus.
OK, it was a really, really simple question. Is it correct that by late February, the UK sent 266,000 pieces of protective equipment to China?
I won't get into a detailed to and fro on the Sunday Times story. More details will be
it's a really simple question.
Shared with people later. Yes.
Why
but I'm
not?
not going to get into it now. I explained that we're going to ensure that an appropriate response to the Sunday Times story is issued later.
OK, so people don't deserve to know whether or not we did send hundreds of thousands of pieces of protective equipment to China in February?
I think it's important that we share facts in a transparent way, and those facts will be shared later today.
The British Healthcare Trades Association, which represents 500 companies, claims in the Sunday Times it was ready to supply protective equipment for 2 months, but its offer to help the NHS wasn't accepted until April the 1st. Is that correct?
Well, there have been a number of organisations that have sought to provide us with personal protective equipment, and we're grateful to all of them. There has been a united national effort in order to make sure that personal protective equipment has both been procured from abroad and also manufactured at home. But again, I'm not going to go through each individual application from each individual organisation, because there are details behind the processing of each application that are sensitive to each firm and to each country.
OK, let's move on to testing, see if we can get any answers when it comes to testing as well. People are, again, very concerned about the level of testing done in the UK. The British In Vitro Diagnostics Association, which represents lots of companies making up the UK's testing sector, said it didn't receive a meaningful approach from the government until April the 1st. Of course, that's the day before Matt Hancock announced the 100,000 a day target. Is that true, or is that something that's off beam?
Well, again, when it comes to our approach towards testing, it is the case that the Department of Health and Social Care have been in touch with a range of organisations, both public and private sector, in order to ensure that we can increase the number of tests in this country. We now have capacity to test 38,000 people a day, and we're on course to be able to test 100,000 people a day by the end of this month. But again, each individual organisation that has approached the government with offers of help has been responded to and dealt with in a particular fashion. And it would again be wrong for me to go through each individual offer at this stage, because there are factors governing each of those approaches which are specific to each company, to each offer and to each test.
Just interested to hear you say that we're on course to meet that 100,000 target by the end of the month. Is that really true? Because it does feel as if that's a very long way to go still.
Yes, we are on course to meet that 100,000 target. As I say, we have the capacity to do 38,000 tests. That's a significant increase on where we were when we last talked.
100,000 capacity or 100,000 tests?
Well, we want to make sure that every test that people are capable of taking is being taken. But you are right to draw attention to the fact that we have the capacity to provide tests to people, but not all of those tests have been taken up. And that's why the Health Secretary has ensured that test capacity is now being extended beyond frontline NHS and social care workers to others in the public sector and other key workers as well, because we want to make sure that, having generated this additional capacity, and I must thank those who've been involved in Public Health England, the NHS and others in the amazing efforts that they've made in order to increase this number. We must make sure, of course, that the additional test capacity is used in the most efficient way possible.
Just to be crystal clear then, is that target now to have a capacity of 100,000 tests by the end of the month, or to actually be carrying out 100,000 tests?
100,000 tests delivered, being carried out by the end of the month.
Now, we've been talking about being behind other countries and being perhaps slow to act in some ways. One area where some people are surprised that we haven't done more on is the wearing of face masks. We've seen other countries recommend people wearing face masks when out in public situations. Do you think the UK government advice could change on that?
Well, the advice will come from our scientific advisors. The clear evidence is that in certain clinical settings, as you know, face masks are absolutely vital. But we also need to reflect on whether or not it would be appropriate, and our medical and scientific advisors have said this, to extend the use of other types of face mask in other settings. But it would be wrong for me to jump the gun and to anticipate what the scientific advice would be. The best way to proceed on these questions is to have our scientists and our doctors look at the evidence, advise government, and then government make a decision on the basis of that independent advice.
Flights entering the country as well, because again, other countries have been swifter than us to lock down on international flights, to impose quarantines. Have we been too slow, and is that something that we're looking at too? I
don't think so, no. And I can understand this is a live area of public debate. But one of the things that we do need to make sure is that we get flights into this country carrying precisely the components that we've just been discussing. It is the case that in order to make sure that we have personal protective equipment, that we have the ingredients for testing, that we have everything that's needed at the front line, that we need to have flights coming into this country. It's also the case that we're repatriating British citizens from abroad, and it's appropriate that they come in. But I do think it's a fair point to say that we do need to think about border controls overall. The advice that we've had, again, from our scientists and doctors, is that none of the flights coming in or the volume of aviation traffic that we've had will have had a significant deleterious effect on the spread of the disease. But again, that's something to be kept under review. My own view is that we should follow the scientific advice. We should heed their call to ensure that we get the equipment that we need. But as with everything, when you have a new virus which poses new challenges, you have to keep things under review.
Listening, I just can't help feeling as if it looks like we're always playing catch-up. We thought we had enough protective equipment, then we realised we didn't. We didn't think testing was a priority. Now we do, and we're trying to scale it up rapidly. We're still reviewing the evidence on face masks. We're still looking at international travel. Why is it that we seem to have acted more slowly than other countries?
Well, the first thing to say is on personal protective equipment, we did have good stocks, and those stocks were built up partly to deal with the pandemic, flu pandemic, partly because of the experience of preparing for a no-deal Brexit.
That's not what people in the front line have told us.
Well, that's what I'm telling you. We did have those stocks, and we built them up. It is the case that with testing we've always recognised its importance, and we've been making sure that we can develop 5 pillars in order to ensure that we can have a range of tests appropriate to the circumstances. And it is the case that when it comes to areas like the wearing of masks, we've been looking at the scientific evidence. But it comes back to our very first sort of stage of this conversation, when you were quite rightly probing and asking when will certain restrictions be lifted. And I said that we wanted to follow the advice and to only proceed when the scientific advice was clear. There is a temptation, of course, to act in certain circumstances because of understandable pressure from commentators and elsewhere, but our approach is to be guided by the science and to move in a way which is not knee-jerk, but considered. But at the same time, it is the case that there is urgent, active and energetic work across the NHS, across the scientific community and across government in order to ensure that where the science is clear, where our action needs to be urgent, that we're taking it, which is why we have managed to increase the number of ventilators in the NHS and bring new ventilators online. It's why we're increasing our testing capacity, and it's why also we are making sure that as well as bringing PPE from abroad, we're also increasing our capacity to manufacture it at home.
OK, now, in the Sunday Times today, they claim that Boris Johnson skipped 5 meetings on coronavirus, the meetings of COBRA, the emergency committee. An unnamed senior Downing Street advisor is quoted in the newspaper saying, "There's no way you're at war if your Prime Minister isn't there. And what you learn about Boris was he didn't chair any meetings, he liked his country breaks, he didn't work weekends. There was a real sense that he didn't do urgent crisis planning. It was exactly like people feared he would be." Now, back in 2016, you withdrew your support for Boris Johnson's leadership bid, saying he cannot provide the leadership or build the team for the task ahead. Given what you've seen in the last few months, were you right or wrong back then?
Totally wrong. The point, I mentioned earlier that the Sunday Times story had 1 or 2 off-beam elements to it. This, I think, is the one that's wildest off-beam. The idea that the Prime Minister skipped meetings that were vital to our response to the coronavirus, I think is grotesque. The truth is that there are meetings across government, some which are chaired by the Health Secretary, some which are chaired by other ministers, but the Prime Minister took all the major decisions. And I think anyone who considered what happened to the Prime Minister just a little while ago, nobody can say that the Prime Minister wasn't throwing heart and soul into fighting this virus. His leadership has been clear, it's been inspirational at times, and I think that actually nothing is more off-beam than the suggestion that the Prime Minister was anything other than energetic, determined, focused and strong in his leadership against this virus.